Lol. Hi, George. Thanks for joining us today.
Hi, Alicia. Thanks for having me on board.
Our pleasure. So let's just start off with some questions that I think are going to be pertinent to providers out there. So how do you see the Aged Care Act reshaping the aged care landscape?
Well, look, the new Aged Care Act has a lot in it. I mean, it's a very complicated and complex act which covers a lot of things. But essentially, what it is doing is providing an opportunity for aged care providers to ramp up their game, basically move away from
Yeah.
being just service providers to actually being a partner in the aging of the individual. So I think it's a major change. We've got, many more obligations now on providers. So providers are going to have to manage those obligations more effectively. They're going to need to be able to follow that participant through their journey,
Mm,
and they're going to have
yep.
responsibilities beyond just the comfort at home, but moving into some degree of clinical care as well. So they're going to be basically having a larger responsibility for the quality of life that our older Australians will be going through.
Absolutely. And I mean, that journey from independent living to residential care, it's quite complex. How can providers better capture and support participants?
Well, and you're right. I mean, it is a complex journey, and it's also very individual. I mean, not everyone
Yeah.
goes down the same pathway. The key, I believe, is good data, having information that enables you to make the right decisions at the right time that are optimized for the participants' experience. And I think that's where having state-of-the-art systems in place that not only capture information, but analyze that information and provide it to the providers in a way they can use to make optimized decisions. The key here is
Yeah.
making sure we get good decision making.
Really understanding each stage of aging and then designing your services to adapt to those needs as they evolve.
Absolutely. And that's really where co-design comes in. You need to understand where each person is on that continuum of aging, what their expectations are, and what their requirements are. And not everyone has the same requirements. I mean, some people would
Yeah,
like
that's
to be
true.
out traveling. Some people were quite happy to stay home. Some people want to, spend more time in their gardens. We need to be able to optimize their experience, but whilst maintaining quality and safety. I mean, that's the really important thing is that, whilst we're giving people a lot more flexibility about what their care looks like, we have to make sure it's
Mm,
safe care, because at the end of the day,
yeah,
if we don't provide safe care, then we're really provide not adding any value.
absolutely. And it's really about that, I guess, relationship and the services follow the person, not the program.
Absolutely, yeah. And that's one of the big changes in the act, and that's one of the big recommendations that came out of the Royal Commission. Yeah, this is no longer a cookie cutter. Everyone gets the
Yeah.
same sort of care. Everyone has individualized care, optimized for them, and they have to play a bigger role in helping decide what that care looks like. So it's a two-way communication. So communication tools are going to be critical. Data tools, so we actually know what people want and have that information available at the point of care, because in anyone's care journey, they could have dozens of different care providers coming in. Unless they can actually
Absolutely.
able to share that data, they won't be able to deliver the quality of care that people deserve.
And that really leads into my next question. Let's talk about home care. How do providers build loyalty in such a competitive space?
Look, yeah, the challenge is, and one of the negatives of this new act is that it sort of tends to bring all the home care things down to a cost. What is the cost of
Right.
each component and what people's requirements are? Whereas the reality is home care has to be integrated into the rest of the services. So it's really important for providers to build the relationships, enable trust. I mean, building trust with their participants and their families is critical, because at the end
Absolutely.
of the day, these people are going to be reliant on this care to hopefully keep them out of residential aged care, keep them at home as long as possible, and keep them home safe and comfortable.
Yes. Yes, absolutely. And I mean, the statement of rights, it's central to the new act. How will this change the aged care business?
Look, in a way, what it does is it documents what good providers are already doing. And I think this provides us an opportunity to
True.
separate the wheat from the chaff effectively. Good
Yeah.
providers have always focused on the quality of care and the rights of the individual who deliver those care. What we've done now is ingrained it. Unfortunately, the Royal Commission did show us that there are some providers who didn't take the rights or respect the rights of the individual. This is important that now this is part of their standards, and failing to do so can lead to them losing their licensure to provide care.
Yeah, it certainly, I mean, I attend obviously a lot of conferences, and I feel like meeting with those aged care providers that were meeting a lot of the standards, it can be quite demoralizing for them, because they look at it and they say, you know, we've got these in place, we're already following this. But, you know, at the end of the day, we have to keep on going back to the participants, look at meeting them, meeting the challenge of their journey. And really also building a more ethical and sustainable sector.
Absolutely. Look, again, the Royal Commission did highlight there were some bad players in the game. Hopefully, these new governance rules will help us eliminate those. The stricter registration requirements, the stricter reporting requirements, hopefully will remove those out of the system who aren't there to provide the high quality care. However, it does add a layer of burden onto the providers as well. It does mean a lot more
And
documenting. It does
complexity.
mean a lot more capturing. So yeah, from a provider's perspective, especially those that have always practiced ethically and have always maintained the quality of care, it's an extra step for them. The good news is that the department is doing a lot of work around a computerized data system to capture that. So
Yes.
at least we won't be having to send in paper forms and filling in sort of online forms. It should be a lot more streamlined.
Absolutely. And I mean, that's from a provider standpoint, but what are the key requirements and I guess ramifications for participants of the system?
Look, they will now be playing a more active role, and they need to recognize that this is now a partnership. They are now not being cared for by the provider. They're
Yep.
working with the provider to optimize their quality of life. So building that relationship between the provider and the participant is critical. And again, data is an important part there, being able to share information so that everybody is technically on the same page. Often with participants, if their family members are actively involved in managing their care. So systems that enable us to provide information across the whole spectrum of people involved in that participant's care will enable us to provide them with higher quality care and also actively engage them in the journey, because this could be a 10, 20, 30-year journey in many cases.
Yeah.
Active participation by the participant is critical to ensuring they get the value that they want and what they deserve.
And I think that's a really good point. You know, when we're looking at the system, that sharing of information is key. But then the other thing that it really puts a spotlight in is on, especially for providers, is making sure they have a reliable way of collecting that data, so that data isn't skewed or that data isn't incorrect. Because if you're sharing it back with the stakeholders, you know, they can actually call that out and say, hey, no, that service wasn't provided, or perhaps, you know, this is where we need improvements, which isn't necessarily a bad thing. It just means, again, the systems have to be really robust that are being integrated into facilities.
So one of the really important things there is being able to capture that data at the point of care. So no longer
Yeah.
reporting it 3 days later when you type up your notes, but actually
The
capture
end of the
information.
day, you know, yeah.
Yeah, I mean, and there's multiple ways of doing that, but having sensors in the rooms or in the facilities is one way of doing that. Having applications which make it easy for the
To capture that.
providers to capture that information. Back in the days we had to fill in paper forms, and often you'd leave it to the end of the day or the end of the week, or sometimes at the end of the
Yeah.
month. I think we've all been guilty of that. But
Oh, guilty of that, definitely.
if we have tools that enable us to capture it whilst we deliver the service, as part of delivering the service, that'll streamline the whole process, and that'll give us real-time information we can act upon. One of the big challenges we've had in the past is that we've dealt on historical data. I mean, the bad things have already happened. There's nothing we can do about it. If we're actually
Mm.
capturing data in real time, we have the opportunity to put in tools that enable us to improve the quality of care at the point of care whilst it's happening. And artificial intelligence is a really exciting aspect of how we can use the data we're capturing for quality improvement in real time.
Yes, and that that perfectly leads me into my next question. You know, looking ahead, what trends do you see shaping aged care?
Look, so I think the one thing was going to be we're going to have a much more enabled participant. So going forward, the baby boomers who will become the next
Yeah,
group going into receiving aged care services are going to be more informed going into this discussion. So they're going to be more actively engaged with their providers. So I think that's going to be a big trend, and I think it's a really good trend. I think it's important that the people who are receiving care play an active role in using that care. The second trend is going to be data. We're going to be capturing a lot more information. We have tools now which can capture, store, and analyze information in real time. So how we use that data will differentiate the good providers from the not so good providers. And there are a number of tools in play. And we were going to hear a lot over the next few years about artificial intelligence, but how we apply artificial intelligence to aged care is going to be a really critical discussion going forward, because we need to do it in such a way that it's focused not just on getting efficiencies, but on improving the quality of life for the participants we engage with.
yeah, enabling those better outcomes. You know, I think when we look at AI, it's very easy to be able to go, okay, we could use it for this, that, and the other, but we still want that interaction person to person, because as you said, it's those relationships. It's
Mhm.
that what really builds that trust. How do we keep that, but use AI in a way that's going to enhance outcomes?
And the key thing here is to use the AI to augment the delivery of care, not replace the delivery of care. Carers and the individual human carers are a critical part of what we do as aged care providers. So what we need to
Absolutely.
do is provide them with support to enable them to do what they do best and remove a lot of the background administrative work that's there. So we talked about it earlier, capturing notes. If you can capture notes in real time and prevent them having to sit down at the end of the day and type in a set of notes, that frees them up to deliver more care, spend more time with the individual, spend more time asking the individual what they want to do. And if the individual has requests, by having the right data in place, they can look up whether that service is available, how they can deliver that service
Yes.
more effectively, and if they can't deliver the service, who they can reach out to help deliver that service.
Absolutely. And that can also help providers as well with looking at what services they need to provide. You know, if they can actually capture where the demand lies, then okay, we know that we want to wrap this service around that. And then that could again enable them further, and especially with retaining and getting new participants as a part of their business and a part of those services that they do provide. Just before we wrap up, any final thoughts?
Look, I think it's a really exciting time. It's been a long time coming. The Royal Commission is what, 4 or 5 years ago now. We all remember
It
the
is.
pain and anguish we went through during that Royal Commission. We saw a very negative aspect of the aged care sector in that Royal Commission, which to me didn't reflect the broader
I
spectrum
agree.
of aged
I
care
agree.
delivery. So I think now we have
Absolutely.
an opportunity to basically to shine, to demonstrate how we can deliver high quality, safe care to older Australians in a cost-effective and efficient way, because one of the changes coming forward, of course, is the co-contribution. So we need to make sure that we're utilising the resources we have to best effect. I think, in 5 years' time, we'll be sitting back and saying, well, yeah, it was a hard journey. We struggled through it. We had some time constraints, and we had some changes of opinion. But now older Australians are getting the higher quality of life that they all deserve.
Absolutely. I couldn't have said it better. Thank you so much for joining me today, George. And I look forward to expanding upon this in person.
Look forward to seeing you at the national conference.
Thanks very much.